Again, thank you everyone for being here. We really appreciate your attendance. We're going to go ahead and introduce some partners of ours who have jobs related in healthcare. So again, my name is Mariana Hernandez and welcome to Land a Job in Healthcare. This is our student webinar today. This is being recorded. You will receive a link to the recording and the slides. So my name is Mariana Hernandez. We're also joined by my colleague, Jose Pelayo, and we are a team of 3 here at LAEDC, which stands for Los Angeles Economic Development Corporation. Our director, Jermaine Hampton, isn't on the call, but he forms part of our group as well, our team. So these webinars are brought about through a partnership with the LA19 community colleges, and this is an effort to provide you with career awareness and opportunities related to your career field. It's also to inform you about the other possibilities that you might not think of as well. So at the end, we'll go ahead and have a feedback poll. So I'd kindly ask everyone to mute themselves. We'll go ahead and have questions at the very end. But I will go ahead and introduce Crystal and Alex from the Community Clinic Association of LA County.
Hello, everyone. My name is Alex. I am with the Community Clinic Association of Los Angeles County. Thank you very much to Mariana and Jose for having us here today. My colleague is having some technical difficulties and she got kicked out of the Zoom somehow. So if you can make me co-host and then I can share the screens and get us started, that would be great.
Of course, Alex, you should be able to share your screen now.
Great. In 1 second while I share our screen. All right, let me go full screen. Can you see my screen?
For some reason, it's blacked out. I don't know if it's the slide or...
Oh, give me 1 second. Not sure why it's doing that. How about now?
There we go.
Great. Again, everyone, welcome to today's presentation on the workforce opportunities offered by the Community Clinic Association of Los Angeles County and how you can help land a job in healthcare, specifically in community health. Again, my name is Alexander Gill, and I am with the Community Clinic Association of Los Angeles County. I am the Assistant Director of Workforce there. I've been with the organization for about 7 years this month, and I really love it. I get to do presentations, go out to colleges, universities, talk to students, encourage them to consider a career in healthcare, tell them about all the great opportunities that are available. Oftentimes people just think about clinical opportunities like being a doctor and a nurse, but there's so many more opportunities that are available and so many more opportunities that you can have beyond just being a doctor or a nurse. So for today, we're going to do an overview of CCALAC and who we are as an organization. And today we're going to focus on 2 of our pipeline programs that we think would be of interest to you all, which is our AmeriCorps program and our Allied Health Internship program. Then we're going to talk a little bit about our job board and some resources, and then we'll take questions and answers at the end. So if you have any questions, please feel free to type it in the chat box, or you can unmute yourself at the end and we will take your questions then. Again, my name is Alexander Gill, and I am the Assistant Director of Workforce. And here today, I also have my colleague, Crystal Torres, and I'll let her introduce herself.
Hi everyone. Good afternoon. Happy Wednesday. My name's Crystal Torres. I'm the project coordinator here at CCALAC. And sorry, I was having technical difficulties, but I'm here and that's great. So I'm excited to connect with you all today. Thank you.
Thanks, Crystal. So for today, we're going to start off with just who we are. So we are the Community Clinic Association of Los Angeles County. I know that's a mouthful. So that is CCALAC. We are a nonprofit that started in 1996. We are not part of the county. Sometimes people get confused and think that we are part of the Department of Health or we're part of the county. We are not. We are an association of clinics from LA County. So as an association, you could think of us as a student club where you have all of these members that are part of the club and that get all of these benefits for being part of that club. So as a club of clinics, we have 66 of them, and they are located all over LA County. They are in Long Beach, in Glendale, in Venice, Santa Monica, downtown LA, East LA, South LA, all over LA County, and they provide primary care. And they provide primary care to the medically under-resourced. So these are patients that are primarily inpatients like Medi-Cal, patients that get other services like CalFresh and things like that. They have over 300 clinical sites all over LA County, and they serve about 1.7 million patients each year. So these are the health centers that we work with that you might be interested in getting a healthcare job with. We're going to show a short video that talks a little bit about just how it is to work in a clinic and why folks work in a clinic. So I'm going to share that momentarily. Give me 1 second.
It's one thing to be part of your community.
Can you all hear?
It's another thing to be part of it and being and serving it, giving back.
I always knew I wanted to work in a clinic setting. I did a comparison and I felt like my services were just better provided here at a clinic setting versus a private office.
Being a part of this community health center really helps us to serve Angelenos and their healthcare needs.
One of the reasons that I continue to work here is because everyone who shows up to work here believes in the mission, and it's palpable.
It's wonderful to work with a great group of other providers and be able to share stories and ask questions and learn from each other.
Being able to help people that are in positions where they need help is pretty rewarding.
My favorite aspect about my role is helping patients get better, how they improve, and hopefully try to cheer them up.
I love how passionate everyone is here, really passionate about giving quality health care to everyone.
Umma represents community in Arabic, but the root word of Umma is which is mother. And that represents, like, what do you feel when you see mother? You see, oh, it's nurturing, it's loving. And knowing that that is a part of what Umma is about is something that, I'm about.
Being here, we're able to provide the access to care that all our patients need. Not only our adult population, our pediatric population, and our elderly population. And I feel that patients have the comfort knowing that, okay, I have a center I can go to.
You know that the people actually really care about their patients and their community, and a lot of the people who work here are from this community.
This is my first job in the medical field. I had other jobs before, but working here has improved my work ethic and skills.
I work here at Queen's Care because I have a passion for helping patients.
We are a non-profit organization. Our main goal is for helping others.
My calling is what wakes me up every morning to be here and serve our community and our patients. And then I think seeing the strength of those around me.
And I want the children of this area who look like me
to see that they can reach whatever dream that they have. And I think if they can come into a clinic and see someone who looks like them, who is in these positions, it motivates them.
I hope you enjoyed that short video. It kind of just highlights some of the staff that work at some of the clinics that we help represent. It really shows the importance of why they work in healthcare. And something that I really want to highlight is, I think one of the persons in the video said that they want people that look like them, right? When some of these patients that come in to work in these health centers, these are patients from all kinds of backgrounds, right? You have patients that are homeless, low income, people of color. When they come in, they want to see people that look like them, people that understand them and can empathize with them. So those are kind of some of the folks that we are looking for, folks that have experience working with these kinds of populations and folks that represent the communities where these health centers are. Here in this map, you can kind of see just an idea of how spread out our health centers are and how we are literally all over LA County and even some parts of Lancaster and Palmdale. So if you're looking to work in a health center, chances are there's a health center near you. A little bit more about some of the services that we provide as a nonprofit to our member clinics is that we provide a lot of networking and peer learning. Every month we host a variety of different roundtables and peer network meetings where we get different staff from the health centers together, either in person or virtually, to discuss topics that are really important to their patients. So it can be things like how to serve homeless patients better, how to be up to date with new Medi-Cal restrictions, how to be up to date on new billing and coding, et cetera, things like that. So through these peer network meetings and roundtables, they are able to really learn from each other and help each other on how to operate better. We also provide them with tons of different resources. For example, during COVID-19, we were helping the clinics get masks and gloves and tons of protective equipment so that they can be able to serve their patients. We also do a variety of pipeline and workforce programs, which we'll talk about today. We also do a lot of technical assistance. So when clinics need help with things like telehealth, telemedicine, if they're not sure about certain policies or procedures, we either have staff on board that can help with that, or we will refer them to someone that can help them with that. We also do a lot of policy and advocacy. We have a department called Government and External Affairs. They go out into, they go out and meet with the legislator. They go out to Sacramento, go out to Washington, DC, and advocate for more funding for our health centers so that there can be more health centers and so the health centers can maintain their doors open in order to serve these medically under-resourced populations. So we are here specifically to talk about our pipeline programs, and we have 4 signature programs. Our first one is a family nurse practitioner residency program. This program is for recently graduated family nurse practitioners. It's a full-time program. It's for 1 year to get placed in one clinic for that year. It's a salaried position, so it is paid throughout the 1 year. They get didactic training. Every week, they get to meet with clinical instructors that teach them how to become better nurses, how to identify certain aspects of whatever they are trying to identify from the patient. There's a scholarship that they receive after the 1 year. And most of the time, what happens is that nurse practitioner will get hired by that clinic that they're serving full-time with a full-time salary and all of the benefits that get offered by that position. So it's a great program if you are a family nurse practitioner who is about to graduate. There are links on our presentation today. So when that gets shared out with you, you can click on all of the links and it will take you to the website page and the application. So if you know someone or are interested in that program, you can just click on the link and it will send you to that page. The next program is our AHIC Scholars Program. This program is a 2-year program. It is for MPH, MSW, medical assistants, community health workers, and certain undergraduate majors. Through this program, you do a minimum of 40 hours of training per year. You do a community project, and then you have an opportunity to do a 250-hour internship at a clinic. It's not necessarily paid, but you do get a stipend once you complete your clinical internship at the clinic. The contact information for that program is there. It's our colleague Andres Sanchez, and the website with more information and details is there, as well as the application. Excuse me. The 2 programs that we are here to really focus on today is our AmeriCorps Health Fellows Program and our Allied Health Internship Program. The AmeriCorps Health Fellows Program is a 10 to 11 month program. It is for recent college graduates or recent high school graduates. The minimum age that you have to be in order to participate in the program is 18 years. It's a full-time program, so you do work anywhere from 35 to 40 hours per week throughout those 10 to 11 months. Throughout that time, you have to complete 1,700 hours, and you get placed in the clinic. While you are in the clinic, you participate in monthly training. You do an orientation, you do monthly trainings, and then you also get more training from the clinic. And then you also participate in community service. So about 2 to 3 times a year, we go out and we do community service. We volunteer at the food bank. We give out food to the homeless, different things like that. It's a great program. It's a great way to get your foot in the door, especially if you are new and want to work in healthcare. It is a paid program. You get $25,500. That gets divided up in equal installments. And then you get a $10,000 education award that you can use to either pursue your education. So if you go on to college, like if you are a recent high school graduate and you go on to college, you can use that to continue your education or pay off any student loans that you might have. The contact for that is our colleague, Janet Gonzalez, and the website and page and application are located there. Our next program is our Allied Health Internship Program, which we are going to go into a lot of detail, so I won't go over that just now. So I'm going to move on to the next slide. I wanted to just show some photos of some of our program participants, just to get you an idea of what they do and, you know, show them in action. These are our 3 current family nurse practitioners. And the pictures that you see on the left is our family nurse practitioner who is currently working at Chinatown Service Center, which is in the downtown LA area. And you can see at the top picture in the top, she is working with her preceptor, who is a doctor and who's kind of teaching her, walking her through how to use the electronic medical records. And in the bottom, she's actually checking the vitals and working with a patient. And then the pictures on the right are them actually receiving training from the nurse, from the clinical nursing instructors over at Cal State LA. In the next set of pictures, you have some of our AmeriCorps Health Fellows throughout the years. You can see them doing community service. We go out and do community service 2 to 3 times a year, like I mentioned. They are out painting a mural at one of the local high schools in the area. We also do some fun stuff. We try to incorporate fun whenever we can. You can see there's pictures of them bowling, of them over at the Santa Monica Pier, pictures of them volunteering at the food bank, and also teaching some middle schoolers about sugar content in sodas and sugary drinks like that. Next set of pictures, you can just kind of see more pictures of what they do in the pictures on the left. And the pictures on the left is them in training. Like I said, they do monthly trainings. We do a variety of different topics of trainings. We do things like customer service, mental health first aid, CPR and first aid. We also do things like leadership, We do panels where we bring different individuals to speak to you about different career opportunities that you have. We do resume and cover letters. We do mock interviews, things like that. So there is a lot of training that is involved, as you can see on the pictures on the left. On the pictures on the right, there's also pictures of them in training. You can see in the bottom right, they are in their CPR training. And then the pictures of the middle, in the middle are just them outside of their clinic. The one in the bottom is APLA Health. The one in the middle is Central Neighborhood Health Foundation. And the one at the top is the Children's Clinic, which is over in the Long Beach area. So again, this program, the audience for it is recent college or high school graduates. A lot of the program participants that participate in this program are pre-med. They're taking a gap year from school. You know, maybe they got their undergrad or their certificate and they want to work for a little bit and then go back to school in a couple of years. So they're taking a gap year. Again, the commitment is full-time. It's 1,700 hours. The stipend is $25,500. You also get health insurance, $10,000 in education awards, monthly training. You also get time off as well. You get to attend our annual symposium. There's all these fun things that we do, like, you know, we go bowling, we do fun things. So you get to network with all these other individuals. This year, there will be a total of 25 different positions for the year. The application website is right there. The staff contact is John Gonzalez. The application deadline for this program is May 31st, and the program is expected to begin in September. You do interview first with the program coordinator, and then after that, you interview with the clinic to see if there's a match. And then once you interview with a few clinics, we try to identify what clinic would be best for you. So you get an option to kind of really pick which one you like the most. And again, in this program, it's an entry-level program. So you work in areas like outreach, enrollment, health education, working with patients in areas like teaching them about diabetes or how to control their blood sugar levels or things like that. You also do case management. A lot of our clinics do a lot of work in street medicine and work with the homeless. So you might be out there with like a physician or a nurse helping support outreach or health education for the homeless. And this program is funded through California Volunteers, which is part of the state, and it is a federally funded program. So it is funded through federal tax dollars. And now my colleague Crystal is going to talk in detail about the Allied Health Internship Program.
Yeah, thank you, Alex. So let's talk about the Allied Health Internship Program. So this program is fairly new, but it's an exciting workforce opportunity for folks in the allied health profession field, or the folks who actually just want experience within community health. So as we know, the allied health professionals are the backbone of healthcare system the healthcare system. They provide optimal care with high patient satisfaction. They really improve the productivity, quality, and effectiveness by working in collaboration with medical staff and their colleagues. So their importance cannot be understated. Another reason why we started this program as well, we know we want to address the workforce shortages within healthcare, and allied health workers make up 60% of the healthcare workforce and are in high demand but short supply. So this program is to alleviate that gap and discrepancy there. And we really want to build the pipeline program aimed to really find qualified and diverse candidates looking for an opportunity to work in healthcare, specifically community health. So the goals of this program is really to discover the next generation of allied health professionals, really invest in their potential and growth, and expose them to the community health world, and also train them by providing them fundamental trainings needed to work in the community health field, and even for them to lead in their profession, as well to connect and really just build connection and promote mentorship and peer networking within their profession. So this opportunity is really is a really great opportunity, and it's another highlight about it. It's a paid opportunity. So we'll go on the next slide. Alrighty, so this allied health internship program, we're looking for 30 students for them to complete a 100-hour internship at one of our member health center clinic sites within LA. And the internships will start around spring and summer of 2023, depending on the students' availability. And prior to the internship, students will participate in 2 fundamental workshops, as well as orientation. And those workshops and orientations are really just ways for folks to engage with their peers, as well as learn about community health, and also put those essential skills into practice, which are like customer service, and just kind of preparing them before their internship at the placement site. And at the end of the internship, students will receive a certificate of completion, and depending on the internship site needs, may receive a job offer. So it's an opportunity for folks to get hired at the end. And again, it's a paid opportunity. And it's a great way for you to get your foot at the door if you kind of want to learn more about community health. So next slide, please. Alrighty, so this is the program benefits. We have a lot of great benefits in this program. So it's a paid 100-hour internship program. You'll be receiving $1,500 at the end of the program. But as well, we want to keep our students engaged. We'll be giving them $25 gift cards for each workshop attended. That includes the 2 mandatory workshops, not orientation, as well as we're going to give them gift card incentives just for being for starting their internship. We'll give you a $25 gift card in the beginning, a $50 midway, and $100 at the end. That's a total of $175 gift card. So I don't know about you, but I love gift cards. So it's a great like incentive to just keep you motivated and continue working in community health. And again, it's an opportunity for you all to learn about community health centers. I know a lot of folks, when they think of healthcare, they think of bigger hospitals such as Kaiser, Cedars-Sinai, but community health centers are really essential and vital for our communities, especially our under-resourced communities. And it's also a great way to really start your career. There's a lot of opportunity for growth and learning just because it's a more intimate setting compared to a bigger hospital. So again, it's an opportunity for you to learn about community health. And again, an opportunity for you to potentially get hired at the end. So we like thinking of it as a long interview for both parties. So it's for the clinic to get to know you and for you to get to know the clinic. So again, you're kind of learning of like, is community health really right for me or not? So it's a great opportunity for you to learn, and also you're getting paid and you're being surrounded by a cohort that's really trying to be in community health and kind of just learn with one another. So overall, it's a great opportunity for you to get your foot at the door, as mentioned earlier, and then at the end, you'll get a certificate awarded. So just as a little highlight, we'll have a cute reception ceremony and really just celebrate your success within the program at the end. Next slide, please. So program requirements, so applicant requirements are, you must submit the application at the deadline. Our deadline actually extended to March 24th, and I'll go more in detail on that. But you must be at least 18 years old. You must attend the 2 virtual workshops and ability to complete the 100-hour in-person internship. So the minimum, actually the slide is kind of wrong, but the minimum hours you can work is 10 hours per week, and the maximum is 25 hours per week within a 5 to 6 week course, and your availability must be from Monday to Friday. Being bilingual is not required, but it's a plus, and it doesn't just have to be Spanish. If you're bilingual in another language, that's great as well, because again, our clinics work with a various diverse populations from all over LA County. So just being bilingual is a plus, but not required. And you must be able to do your internship hours between 8 to 5, because those are the times our clinics are open, and must live in the LA County. We want to make sure you are from LA County, just because the closer you are within your place of work, we don't want folks to be traveling so far. Traffic can be intense in LA. So we want you to be part of LA County and must have reliable transportation and must be in the last 4 to 6 months of your program. So you must be graduating this year in order to participate in this program, because we want you to already be certified and ready to go and be ready to be part of the workforce. So, and must be in one of the areas of study, which I'll go more into detail in the next slide. Oh, so this is another potential requirements for clinic placement. So just so you know, our requirements, we do ask you to be COVID-19 vaccinated and have proof of vaccination, but clinics might ask you to also have TB test, ask for a physical or immunization records prior to starting there, and also they may ask you to pass a background check. And they may ask you other items that we have not mentioned. But so there's like a further onboarding process, just so folks are like aware. Next slide. So these are the accepted areas of study. We're looking for medical assistants, licensed vocational nurses, pharmacy techs, health information technology folks, building and coding folks, dental assistant, dental hygienist, phlebotomists, community health workers, promotores or promotoras, substance abuse counselors, patient care representative, patient navigator, care coordinator, administrative roles, customer service, reception, call center. So if you have that experience, you should definitely apply. Undergrad majors within community health, health education, social work, or health administration. And if you're unsure, you can feel free to contact us. You have our email there, as well as my email, which is ctorres@cclac.org. But we're looking for a diverse range of folks within the allied health profession. So don't don't hesitate to contact us. I'm really looking for folks who are just really interested in working in community health and really show that in your application. Next slide. So this is the program timeline. So the application opened this month. As you know, this program is new, so it was super exciting to launch the application, and the interviews is on a rolling basis. So basically, once I receive your application and it looks good to go, I'll send you an interview invite, as well as the it's on a first come first serve basis. So the sooner you can get your time slot, the sooner you'll get your interview. And the application deadline is until March 24th at 11:59 of this month. So you have a little bit more than a week to submit your application, and acceptance letters will be sent around March. So this month, probably also maybe early April if we get some folks at the end. And then the program will begin April 13th. That's when orientation is, and orientation and the virtual workshops are in the evening from 6 to 8 p.m. So we really want to make this program really flexible for folks, because we do know that they have other responsibilities such as finishing school. So we really want to make sure it's flexible. And the didactic trainings is April 20 and April 27, and the externship will begin on a rolling basis, meaning that some folks might start in the summer, or some might start right away, so after the workshop number 2. So it all depends on your availability, and we're letting clinics know to really be flexible with you all who are trying to be part of the program, because we know how important it is to be flexible, especially in the careers you're in. So and the externship, again, will end in a rolling basis, but we will have the graduation ceremony, depending on the cohort, either late summer or early fall. So folks can convene, and again, we'll have like a great little ceremony, and that one would be most likely in person. So next slide. All right, so the program application is really straightforward. We're gonna and simple. So the first section is the demographic question. So it's really your contact information. And the second section is the area of study. I just want to know where you're taking your program, where you're getting your licensure, and when are you graduating, and your personal insight questions. So we only ask 2 personal insight questions, which are really like the mini essay questions, but they can be a meaningful paragraph, nothing too long, or like we don't want a dissertation. We just want a meaningful paragraph on why you want to work in community health, and also your experience working with diverse community-based populations. So if you write a meaningful paragraph for that, and also your up-to-date resume, because that would help us as well to see your work experience. So that's all we ask, and then you'll just click submit. Next slide. Alrighty, so program expectations. So you must attend and engage in both virtual didactic workshops. So we really want folks to be curious, respectful, and present within the workshops. We really want folks to listen actively, promote respect, encourage open dialogue, and embrace vulnerability. Again, the cohort is going to be very diverse, as you can see from the allied health professions I mentioned, and they're all coming from different walks of life, meaning some folks might have a lot of experience already while others don't. So we really just want folks to really encourage that open dialogue and just be open with one another and really promote like that peer network um, what do you call it, community within the cohort. And we really want to invest in our professional development that will benefit, again, your career pathway, and again connect with your cohort and network for those workshops. And you must complete the 100-hour in-person internship experience at the respective clinic site. So again, it's 10 hours per week minimum, 25 hours per week maximum. And we really want you to optimize your experience there, engage with your supervisor, find mentors, and connect with peers. We're letting clinics know to also optimize their experience with you and really build that mentorship, because it's super important when you're part of the workforce to find that mentor and really grow within your career. And also take initiative and utilize all the resources and opportunities to grow during your internship. So we really want folks to grow and really really find this program impactful within their own career pathway. And again, we want folks to communicate and complete required forms. You must be responsive to our emails in a timely manner and complete evaluation and alumni surveys during and after graduating from the program. So you'll get more in detail if you get invited for orientation, but we really value communication. That's key, especially in the virtual environment, and just having those forms ready so you're ready to start your externship at the clinic. So apply now. I really encourage folks to apply. That's the link. And again, the deadline to apply is March 24th. I also added the links to all the programs on the chat as well, if you want to look at it now. So yeah, I hope to see your application and hope to connect with you later on. Thank you.
Thank you, Crystal. Next, before we take questions, we want to talk a little bit about some other resources via our job board and our resume bank. One of the great things that we have is we have a job board where we post all of the jobs that are available at our health centers. And these are clinical and non-clinical jobs. You'll see everything from doctors and nurses to receptionists, medical assistants, dental assistants, drivers, janitors, anything that you can think of, anyone that works in any of the health centers in any capacity, you'll see different job opportunities. You can filter and by category, and then you're able to see the location, some of the languages that are required for the position, whether it's full-time or part-time, and then you can also view how much they pay. So if it's an hourly position, you can see what they offer hourly. If it's salary, you can see what they offer salary. Also on our website, you can submit your resume. And if you submit your resume and you tell us a little bit about what you're looking for, so if you tell us, I am looking for a medical assistant position in the area of Glendale, then we will send out your resume to our clinics for 60 days. And then hopefully there'll be a match with one of the clinics, and they'll contact you, set up an interview, and hopefully you get hired. Another thing that you can do via our job board is subscribe to the job board newsletter. If you subscribe to the newsletter, you get one monthly newsletter per month where you get updates on new programs that we have, like this program that Crystal just mentioned, or different opportunities that are available, and of course, new jobs that get posted to our job board. This is how the resume bank looks like. It's a really easy form to fill out. You just put your name, email, what kind of position you're looking for, your availability, again, what geographic preference you have, and then you upload your resume, and then we send it off, and again, it gets circulated for 60 days. These are the links. Well, the first one is our website. A job board is just / job board, and then the next link is to submit your resume to our resume bank. any questions for either Crystal or myself about anything that we mentioned, anything about health centers, any of the programs. For the Allied Health Internship Program, we will have that program again next year. So maybe if you're not eligible this year or you're not graduating this year and you want to participate in it next year, we will have that program again next year. So you might be eligible to participate then. But any questions in the chat box, or anyone want to unmute themselves and ask a question?
I actually received a private question from Celeste, I believe. It's asking which program would be best if you have a CNA certificate and a dental assisting certificate through the USC TRIO program, Allied Health program. I will graduate this year and turn 18 in November. Would that be a problem? Oh, well, that's awesome that you already have the certificate at such a young age. I think that's amazing. So you do qualify with the dental assistant certificate program. However, I think because you're about to turn 18 in November, you would probably not be able to do the program. Correct, Alex?
Correct. Just because for liability and insurance reasons, clinics do require for anyone, even most volunteers, to be at least 18. So we would have to wait for you to be at least 18. But we encourage you to apply because things change. Folks drop out of the program, things can change. So I would say apply for our Allied Health Internship Program. We can put you on the waiting list. And if we can have you do an internship later on in the fall after you turn 18, we can accommodate that.
Yeah, I hope that answers your questions and still encourages you to apply. So, or if anything, you can always apply next year for sure.
I have a question.
Yeah.
I finished the IHHS course at LACC. I have the certification. I did the CPR hours, all that. And I am graduating next month in May for MA from American Career College. Would I qualify for that program?
Yes, we're looking for medical assistance. So I hope to see your application, Tanya.
Great.
Yeah, definitely. You're just the person we're looking for. So yes, please apply. And we are looking for tons of medical assistants. So you will have no trouble finding a position.
Great, because I've been trying to find something. Thank you.
Thank you, Tanya. Thank you, Alex and Crystal. We have a question in the chat, so I'll go ahead and read it off to you guys. Would it be appropriate to apply with a business analyst certificate and a declared major in psychology? I am working on the certificate now and should finish I can't see what the month is for some reason. I don't have any experience in healthcare, but am interested in applying to healthcare administration in the near future.
Definitely, we can definitely consider your application. As long as you say why you want to participate in the program. It does have to be in the year that you are graduating. So if you are graduating in the fall,
yeah,
of 2023, then you would have to apply in 2024. So right now we are taking those graduates that are graduating in the next couple of months. So folks that are graduating in May or June.
Would they need to graduate with their AA or their bachelor's?
For the Allied Health Internship Program, you don't have to graduate with either. It can be just the certificate. So if you got your medical assistant certificate, or if you became a dental assistant, then those. And the same thing for AmeriCorps. All you need to have is at least a high school diploma.
Okay, Carol, if you so this question is coming from Carol, and she already has a bachelor's degree in music, but she's a returning student trying to change fields, and she has a business analyst certificate.
And she would definitely be more suited for our AmeriCorps Health Fellows program because she already has a bachelor's degree. And that could really segue her into getting an entry-level position in healthcare. So I would definitely tell you to apply to our AmeriCorps program and check out the website. There's tons of information on there about it.
I also encourage Carol, if she does want to apply to this program, you could apply, but just write why you want to work in community health, and maybe we can put you on the wait list. And also to keep your contact information when the AmeriCorps program opens as well.
I think I did see another question prior to this one.
I got a lot of private questions. So let me see. So someone told me, that they got their medical assistant license a while back. So, but they haven't worked for it they haven't used it. I guess they haven't worked in that field yet, but they graduate from Long Beach City College for an associate's degree. So you definitely qualify because you have the licensure and you're about to get your associate's degree in biological science as well. So I hope to see your application as well, Chonita. So thank you.
Yeah, if you are about to graduate, you qualify, or if you have graduated in the past, but just maybe didn't get a chance to use your certificate or practice what you got your certificate in, you are still eligible.
Then I got another question saying, how do you select the candidates? Are there a certain number of applicants you're taking? So we want to take 30 candidates this year for this program. The way I'm selecting candidates based on one, your application, and two, based on the interview. You will get invited to a 30-minute interview with me, and just based on how you do well on the interview, you'll get an invite. So again, the interview, I know it could be scary, but it's just the moment for me to kind of get to know you and your interests and really just see the person behind the paper, because sometimes it could be hard to see someone's personality within just the application. So yeah, I'm basically getting candidates based on who applies and who attends the interview and how successful you are in the interviews. And there isn't any, what do you call it? We're not looking for because I know you said, are there any certain number of you're getting your phlebotomy certificate this semester? Yeah, I encourage you to apply. There isn't like a maximum number, like we're only looking for max MAs, max phlebotomists, max this. It's basically, again, we really are looking for just a diverse group of folks who are just interested in community health and qualify within the program.
Yeah, we're looking for folks that in their application demonstrate that they want to work in community health, because obviously the ultimate goal of the internship program is for you to land a full-time job with, of course, all the great benefits and all that. So we want someone who demonstrates that they want to work in community health.
And I got another question, and says, my name is Adida Reyes, and I'm currently a freshman pre-med biology major at Cerritos College. Your internship was exactly what I've been looking for.
In the meantime, Alex.
Okay.
Oh, you got it.
I was just saying, I guess it was more of a comment, but it's good that you're getting the information now, so when you do qualify to apply, you do apply to these programs. So I appreciate your comment. Sorry, I thought it was a question. Oh wait, I'm also
there is a question on the chat.
Yeah,
and
I can answer that one.
Yeah,
so
go ahead.
I have completed the medical billing and coding in January. So that yes, we are looking for medical billers and coders. So you are just the person that we're looking for that does qualify for the program. So please apply, and we can definitely find replacement for you to do your internship, and then you can most definitely be hired for sure. They are always looking for medical billers and coders. And that question was from May Lane.
Yeah, so we still have a few more minutes. Again, I encourage you guys to unmute yourself. It's also great practice for the interview phase if you guys do apply, and speak up and ask any questions to build those communication skills. But you have a few more minutes to ask any questions to our guest panelists. I recommend you ask any questions. There's no wrong questions. If you are a little bit shy, you're more than welcome to also type it in. But Mariana will also be launching a poll shortly. In the meantime, again, please feel free to ask the panelists any questions.
Yeah, and if you're not sure about a question just now, but you want to ask a question or you think of one later, please email us at recruitment@ccalac.org, and then we can answer your question there. But we hope to see you all apply to one or more of our programs.
Thank you, Alex. So everyone should be seeing the poll on their screen. If you guys could just take a moment to answer that. We've already gotten a lot of great responses. And as Jose mentioned, we have a few minutes. So if you have any questions you'd like answered, just go ahead and enter them in the chat or unmute. We'll also be sharing the recording and all of the links so you have them easily accessible. So we're not getting any questions. I don't know, Crystal, if you had any other direct questions sent to you.
Yeah, I had a couple, so I was just answering them. So one of them was asking about the hours. So again, the hours is between 8 to 5, and you get to discuss your availability with the clinic site for your hours. So again, we're trying to be super flexible as possible. So even in the application, it asks for your availability as well. So we're trying to match based on your availability and the clinic's needs, so that so like if you have other stuff around, again, the minimum requirements to work per week is 10 hours per week. So I think that's super feasible and doable if you're interested in the program.
Yeah. And you don't have to be available the whole time, not all of 8 to 5. It's just that for the most part, clinics are open from 8 to 5. So you can do like, Mondays and Tuesdays from 8 to 12, as part of your schedule. So you just have to be open sometime from 8 to 5.
Perfect, thank you. So I don't see any more questions.
One more question that just came in. It's a long one. I have a couple of schooling associate degrees that will be graduating in May that include an associate's degree in sociology, healthcare administration, as well as certificates like office clerk, medical transcription, etc. I have worked in the medical field as a medical receptionist, patient registrar, scheduler for 5 years. However, obtaining employment is very difficult. For the employment recruitment to be able to assist with permanent employment based on my experience and schooling, I am also working towards a degree with substance abuse and medical billing and coding. However, that won't be done for the following year. So it does sound like you have already a lot of certificates and a lot of experience. So if you're looking for straight employment, like you're looking to get employed now, I would check out our job board because there's a lot of opportunities that you are definitely eligible for now, and you can definitely apply for now. If you're having difficulty with maybe getting some response back, then maybe I encourage you to then apply for our internship program, because even though it is a short period, 100 hours, it's a great segue to get your foot in the door. So I encourage you to really apply for our allied health program, because if you're having difficulty in getting your resume noticed by some of the HR recruiters, then maybe this would be a good segue for you, because you do have the education experience and experience. Yeah.
Thank you, Alex. I got another question asking, do you need to have a certification in order to apply? And yes, but it depends on the allied health profession. For example, I believe like dental assistants, if you have the experience, I still encourage you to apply. But again, if you have the certificate for dental assistants, you most likely are like going to be the preferred option. So that's just my answer to that question.
Thank you, Crystal and Alex. I don't see any more questions, so we'll go ahead and conclude our webinar. Thank you again both for sharing all of these resources. It's very well received, and we'll go ahead and share it with the Career Center so that they can circulate the recording and the links and your contact information. And if we get any direct questions, we'll go ahead and forward those messages to you as well. But thank you so much for taking the time to speak to the students today. It was a great webinar, and we hope that everyone has a great rest of your afternoon.
Sounds good. Thank you very much, everyone.
Thank you.
Thank you, everyone. Take care.